Okay, and once again, hi, this is Pam Henry from MyCareConnect BlueLoop. I want to thank all of you who have taken time to join us tonight for our webinar, Being Prepared, Tips and Tricks for Everyday to Extreme. What I'd like to do first is introduce our panelists to you. We're thankful to both Chris Tuck and to Angela Johnston, who are joining me this evening in order to talk about both their experiences with being prepared and what they've learned from other people's experiences and from their educations. So I am Pam Henry, and that's my daughter Sarah that you see there in the picture. And then Chris is Health Services Director in Topeka, Kansas. And then finally we have Angela Johnston. She is the mom of a child with type 1 diabetes and has recently experienced a tornado of her own. She lives in Oklahoma, so she's had lots of opportunities, unfortunately, for such experiences and learning opportunities. What I'd like to do before we jump in is go through just a couple of instructional items for you so that you all will fully understand how to get the most from this webinar. First of all, I want to let you know that in as much as it's possible with the fact that the attendees cannot speak, I do want this to be a conversation, and I want it to be a sharing of ideas and questions. So in order for you all to suggest something that has worked for you or ask a question about a specific situation, there is a box in your control panel to the far right of the screen that says questions. And what we'll do is at the end of each topic section, I will ask everyone to go ahead and submit any questions or comments that they might have. And as we go through, we will try our best to get to all of those questions and suggestions. If we are not able to get to all of them, please know that in 2 days we will have both a recording of this webinar and a list of the transcript from this webinar, which means that any questions or comments that were made by attendees during the webinar will be made available. So first of all, I would like to give you a quick introduction to my company, which is MyCareConnect BlueLoop, and how it would be relevant in being prepared for both everyday situations and for extreme situations like natural disasters. BlueLoop is a mobile app that it works in conjunction with our online app, which is MyCareConnect.com. And BlueLoop allows users, specifically children, to communicate with their parents or to any other caregivers, including school nurses and doctor's offices. It allows them to enter information, and specific caregivers, based on notification rules and access rules, are able to see those communications and communicate back and forth with each other. So, for example, if a child is at school, they can enter information like blood sugar and carbs in a note, and both mom and the school nurse could see that those entries. If a mom is at home and needs to get in touch with her child at school for some reason, mom can go into the BlueLoop account and enter comments that both the nurse and the student could see. And then, as you might could guess, the school nurse could also go on there and do any communications necessary with the student or the mom or the doctor's office for that matter. And if you do want further information about BlueLoop, just go to MyCareConnect.com. We'll provide that web address at the end of the webinar, and we're happy also to answer any questions after tonight that anyone might have about BlueLoop. But I think that the more important part of this webinar is, again, our sharing of ideas and experiences and all just having a conversation and helping each other out. So that's what I'd like to move into. So the first topic I'd like to talk about is just everyday things, dinners, birthday parties, family outings. I don't want us to necessarily, for everyone to answer this question of what if I forget my child's test kit. When we put questions at the top of the screen here, they're just conversation starters or ways for you to get ideas in your head about various situations you might have been in, whether it's forgetting your child's test kit or something else along those lines. And you can see over here on the far left side that we will talk about, within these everyday situations, we'll talk about going out, we'll talk about sleepovers, school, and travel. And then we'll get into more extreme cases with school, not an everyday occurrence, but something in school like perhaps a lockdown or a fire or fire drill even. We'll talk about travel and extreme cases with travel, like being stuck on a runway or having your supplies stolen. And then we'll talk about natural disasters. So again, first with going out, I'll share just a little experience of my own. My daughter, Sarah, is 16. She was diagnosed at 6. And as a mom who, as we all have been very new to diabetes, my husband and I were, in doing our very good jobs of being a parent, we were a little bit over-anxious, I guess you could call it. And early on, if Sarah forgot her test kit, if we'd get to a restaurant and we realized that Sarah had forgotten her test kit, not only would we panic, but one of us would drive home and get the test kit and come back to the restaurant and not be overly happy for the rest of the evening. And we figured out fairly quickly that both for our sakes and for Sarah's, from a learning experience, we can't expect to always have the test kit with us. We can't expect that we will never make such mistakes. So we started to just talk to Sarah about, okay, we've forgotten this test kit. What can we do now? Let's see how you feel. Do you feel high? Do you feel low? Maybe the best thing to do is just to give insulin for the carbs that you're going to eat at dinner. So I think the main thing we learned is to not expect perfection from ourselves and to realize that this is a lifelong thing for Sarah and that we need to teach her how to cope with those things as well. So Angela, do you have anything that you could add to that? Anything that you've experienced? And I will say, Angela, as you're talking, if anyone out there does have questions or their own tips, you can go ahead and start submitting them now, and we'll start answering those once Angela and Chris have had a chance to talk.
Yeah, this is Angela. I have also come across the same situation you have, and that's kind of similar to how we handled it. To keep everyone even and not stress anyone out, we have also done the, just take for what we have and try to calculate as close as you can to what you're eating and take that insulin, and that's always worked well for us too.
Good. Chris, is there anything that you can add to that? Surely you've had students at school who have left supplies at home, or their pump has suddenly quit working. Is there anything that you could add, an experience, or certain things that you have found that work well?
You bet. Another thing that sometimes happens is that the little battery on the glucometer is suddenly dead. And if you don't have an extra one, that can cause some chaos for the student too. But we do exactly the same thing. We just talk to the student and the child and ask them, do they remember what their blood glucose was before they came to school, and then, how's your morning gone, and, have you had any extra snacks, and then simply treat with, knowing how many carbs they're taking at that lunchtime meal, and then just having them, recognize how they feel, and then let us know if there's anything out of the ordinary.
Right. Okay. And I don't see that any questions have been submitted. Katie or Melissa, they're my helpers on this. Katie or Melissa, are you seeing any questions or tips that anyone has submitted? Okay, I'm now actually seeing one. Let's see. This one says, is everything you're going over have to do with tube pump or handheld? We use the Omnipod, which tests and delivers. Just wondering because this may not pertain to us. No, our goal here, and I'm kind of glad you mentioned that, because our goal here is to talk in terms of anyone with diabetes. So I think with the fact that Chris and my child uses an insulin pump, we might have the tendency, or excuse me, Angela is my child, we might have that tendency to talk in terms of insulin pumps. So yeah, we do need to make sure that, and keep us in line on this, that we do talk in general terms about diabetes and any supplies, really, that might get left behind. So thank you for your question. Let's see, one person has asked, what could a person with a pod do if they forget their PDM? That's a good question. Chris, as a nurse, have you had any experiences with pods and PDMs at all?
No, I mean, we have, but typically the parents are fairly, in close proximity where they can run us up whatever we need. We try to always have a backup of an insulin pen or some other type of glucose monitoring device because if those situations happen. But right off the top of my head, in all my years as a school nurse and working with pods and different things, I honestly can't think of a problem that we've had during the school day with that situation.
Okay, yeah, and we have had one participant suggest that you do give shots. So that's a good thing to keep in mind, is to always have those backup supplies with you. Yeah. Let's see, we have another question here. How do you manage a middle school student going from class to class in regards to keeping his sugars level and maintained so that he can focus on his schoolwork? And saying, I do know that that's a tough question. One thing, this is a great question. I do want to put it off until after we talk about the school situation. So if we can hold off on that for just a moment, and I do have a question about sleepovers, so let's go ahead and move in to that section. Okay, sorry. Okay, so as far as sleepovers, again, these are just thought provokers, but definitely parents have questions about what to pack, how much to pack, what if their child forgets to check or to take insulin, and whether or not their child is comfortable checking their blood glucose in front of their friends. An obvious question, I think, too, is what and how much to tell the parent of the child where the sleepover is happening. And obviously that might vary depending on the age of the child. My only piece of advice is that I always let Sarah run high when she goes on sleepovers because of the fact that a low is a more immediate danger. Whereas if I just let her run high, then nothing detrimental can happen within an 8 or 12-hour period. And now that I've said that, I'm sure someone will disagree with me. But in comparison to a low blood sugar, it has always worked well for me to let her run a little bit on the high side. So again, Chris or Angela, do you have any things that you have found work well with you, or I know that when you and I talked the other day, you said something about when you talk to parents of the child where the sleepover is.
Yeah, this is Angela. Whenever Reagan was younger, the parents seemed to have some anxiety of when she was spending the night with someone. What can she eat? What can I feed her? Can she have birthday cake, or can she have this? And I just simply ease their mind to say, Reagan, I taught her how to, what she needs to manage and put that responsibility on her. Reagan was diagnosed when she was 11, so she was at the age where she could, make decisions. And, if she got a little bit more cake than she should have at the birthday party sleepover, then we kind of were like you. It was okay for that point. We didn't have to be on point to the T with her blood sugars. And I just like to ease the parent's mind that Reagan could pretty well manage it on her own, and that they didn't have to worry about her. And it seems like it was more of a relaxed atmosphere whenever she did do sleepovers. I also, whenever she's does sleep over, we communicate through the night, and or not during the night when they sleep, but you know, before bed, we always communicate what's your blood sugar, and I relate that to the parents that she's staying with, that, you know, I'll take care of that, and I'll always communicate so that they don't, you know, some people are very foreign to having a diabetic in the home and haven't ever dealt with diabetes. And so I have always found that if I try to ease their mind more and let them know that Reagan and I are communicating and the things that we've taught her, that it usually runs really well doing a sleepover.
Great. And this is Pam. This is an example of where the BlueLoop app would come in handy, because it is can be used on any smartphone. It's an Android and iPhone app. And this is where, in a more discreet way, your child, especially a teenager, we had someone ask about dealing with their teenager at sleepovers. This is where you can give your teen a little bit more independence and say, hey, you know, enter those numbers on BlueLoop. I'll see those numbers. I'll know you're handling yourself well. And, you know, we don't have to make those phone calls back and forth. So I think that as long as you think that your child can handle it and has shown that they will communicate with you, that a teenager needs as much independence as do all kids, normalcy as possible. So a couple quick comments, and then we'll move on to school. I did have a school nurse comment that she's glad to hear us talking about running high versus running low, and that it's much the same at school, that if you have to err one direction or the other, that she would certainly rather a child run a little bit high than a little bit low. Let's see. Okay, I have a comment / question here. My child is 4 and just diagnosed in January. He doesn't recognize when he's high or low, and I feel like I can't let him go to any play date or party unless I'm there. At what age does one start letting a child manage their own diabetes? I know it has to be very individual, but wondering what I might expect. So, Angela, I know that you said your child was 11. Sarah was 6, and that was a tough age. With your child being 4, to be honest, I would probably go on those play dates with the child. Sarah went through a phase where she could not feel low blood sugars, and that is a very scary thing, because whether it be a 4-year-old or a 10 or 18-year-old, that definitely needs some extra supervision and management. So as far as letting them manage their own diabetes, I think that starts as early as when they're testing, and it can be subtle. Like, you know, if it's a 4-year-old, you test, and then you say, oh, your number is 234. That means that we should do this. And while I'm saying all that, I would like to stress, and I know that more awareness is out there, but the importance of not reacting to a blood sugar in a way of, oh my gosh, your blood sugar's high, what did you do wrong? Or, oh my gosh, you're low, I better run over to the pantry and get you a juicy juice. It needs to be a very matter-of-fact thing with the child, as much as possible, so that they don't feel like that they should hide it or that they should be ashamed of it. Because I can tell you, as the mom of a teenager, when hormones kick in, you can do everything right and you're still going to get crazy numbers. And it's not your fault, and it's not your child's fault. And I'm sorry, I'll get off my soapbox here. But so the self-management, I think it does start with you as the parent thinking out loud and letting them hear your thinking process. And then eventually you saying, you know, your blood sugar's 200. What do you think we should do about that? You know, not what do you think caused it, and unless you ask subtle questions like, you know, do you think maybe we didn't bolus enough or give enough insulin at dinner? But again, I think it's the thinking out loud and slowly asking them to give input as well, so that they feel more ownership of it. Let me read just a couple more, and then Angela, I'll get you in the loop here as well. One question, do you think it would be a good idea to ask teenage friends to help watch out with the type 1? I would say absolutely. And again, with Sarah being diagnosed at 6, all her friends have grown up with it, so they're very aware of it and don't think it's too big a deal. Angela, can you give us some insight with being 11 at diagnosis?
Yes, and I can say on the sleepovers, we were very blessed, but we went into it like we're not going to hide it. This is going to be her life. And so we just try to educate people that are around us and that are involved in our lives. And so when we spent the night, my suggestion was that, you know, if the parent was apprehensive, or Reagan, if she hadn't slept with that person before, you know, I would say if you want to wake her up at 3 o'clock and test her blood sugar just for your reassurance, then they would do that, and I was very grateful for that. And then at that point you say, okay, is she low, is she high? Even we have had situations where they were kind of iffy on it, you know, being 90 or something at that point, and so they'd unplug her pump until the morning time when she woke up, you know, because in the same case it's okay to run a little bit high in that situation. So that, I mean, we had good success with that in the early years. As far as the other children knowing, this has been a lifesaver for me because my daughter has many friends, but her very good friends that are with her a lot, we have taught them or showed them how to use the glucagon. You know, my daughter is very active and she goes to a lot of camps for weeks at a time. And she usually has 1 or 2 girls that know her really well that are always with her. And so I know I even have her friends' cell phone numbers in my phone so that if I can't get a hold of Reagan, I know they're with her, the other friend, and I will contact that friend. Or, you know, I have always, and it's like in the very beginning, I kind of did a diabetes education from a mom's point of view on being the caregiver if something does happen to Reagan, what she will act like, what she will look like. If she goes low, she kind of is, you know, out of it, and those symptoms, and taught the children, her friends, what to do and what to look for, and that has always worked really good for us. So I really suggest that the ones that they're around a lot to educate them on what, and kind of like have a buddy system with you and with the child.
Okay. We have another question from an audience member, and Chris, I think that this would be one that you would be well equipped to answer. The question is, my son is 7 and doesn't administer his insulin himself. I prepare the insulin needles and baggies labeled for each meal. Does this decrease the potency of the insulin if it's not used until the next morning?
It really shouldn't unless it's in extreme temperatures, like if it was in the winter and it was sitting out in the cold, or you know, really hot like it has been now and it's sitting in your car. I'm assuming that there isn't a registered nurse or anyone at the school that could help, and so that's probably her only option to safely be able to do that. I'm wondering if an insulin pen might be a little bit easier than drawing it up in each of the syringes. You know, that might be one suggestion that she might check. But, you know, everybody finds out what works for them, and they just have to go with it. So, I mean, no, I can't think of any reason why, as long as it's not in extreme temperatures, you know, that could you know, bother the insulin itself. She should be fine.
Okay, great. Thank you. Okay, let's move on to school. And again, if anyone thinks of questions, whether it to be or tips, whether it's going out or sleepovers or anything, feel free to go ahead and submit them after the fact, and we'll make sure that they end up in our transcript that everyone will be able to see. Okay, so school. First day of school as a type 1, how lunch is handled, extracurricular activities, field trips. Of course, we have a million stories that we could all share, I'm sure. one thing that, just a tip that I found very helpful with Sarah is, especially in elementary school, when she would go to the school nurse after lunch with her tray and they would count carbs and give insulin, one of my concerns is the fact that she was not receiving any insulin until a good 20 or 30 minutes after lunch started. So one thing we started doing is Sarah tested in the classroom. So we would have her test about 15 minutes before lunch started, and she would always give herself insulin for 40 carbs. And of course that number can be whatever you want it to be, but we knew that she would always eat at least 40 carbs at lunch. So we would go ahead and give insulin for those 40 carbs, and then when she counted the actual carbs consumed with her school nurse, they would then give the difference for that insulin amount. Angela, anything that you can think of that you have found helpful?
One suggestion that I have for as far as school is my daughter always wants to be in just like the other kids. So I have always, since day one, even until she's a senior, first day of school, I write a letter to every teacher that she has and every teacher that she will be affected or in their classroom. And I just let them know she has diabetes. You know, she may need water. She requires snacks to be with her at all times or in the room. Some things that might happen if she goes low and she needs assistance. And then I also give them my cell phone number. And I have always been really pleased with that opens a communication with the teacher and me, and in communicating with that. And we've never really had any problems or surprises. Oh, I didn't know, you know, she had diabetes, because I established that on the first day of school, and it's always been very successful for us.
Great. I have had a school nurse here submit a comment that in California, where she lives, she doesn't think that a child with diabetes could take a pre-filled syringes to school that doesn't have a label on it from the pharmacy. So that's where it is very important to talk to your school and to talk to your school nurse about what will work best, and not have any surprises with, oh, I didn't realize you couldn't take a syringe that was pre-filled. And as far as the beginning of the school year and preparing for school to start is a very, very important time. And unfortunately, we don't have the time to go into all of that here on this 1-hour call tonight. But I would encourage all of you to go out there on the internet and look at what there is, information about it. That laws do vary from state to state, so you would do well to educate yourself about the laws in your state. And part of the list that we will make available in 2 days after, once we're able to get the recording of the webinar online, some of the lists that we will provide will include resources like links to the American Diabetes Association website and things like that, where you can get some back-to-school help. I'll read this one more comment from a school nurse, and then for the sake of time, we will go ahead and move on to travel. As a high school nurse, the best tip I can give is to have good communication between parents and the nurse. I also give a checklist out to my parents for back to school with things that they will need, from testing supplies, doctor's orders, snacks, etc. That's great, and it's great to see that we all know that the majority of school nurses out there are proactive and care very much about keeping our kids healthy. And so it's nice to see that there are those nurses who are taking the initiative to communicate with the parents in that way.
This is
okay,
Chris
so,
again. I just want to highlight that you're absolutely right. If that school district does have that school nurse, then most likely you're going to have that written diabetes medical management plan. You'll have an emergency action plan. You'll know what's in those syringes when they come to school, because you'll have the physician order. Also, many times the school nurse works hand in hand with the food service director to actually aggregate out the nutritive value of all the foods that are in the school lunch. and that's a real simple way to educate your diabetic students on how many carbs they're taking, so you can actually give them their insulin before they eat. So all those things culminate together to show that the most effective management for diabetes is those partnerships among the students, the parents, the school nurse, the healthcare providers, and all school staff.
Great, thank you.
Yep.
And I apologize. There was a question earlier that I said that we would need to put off until we talked about school. So I do want to answer that question before we move on to travel. And the question was, how do you manage a middle school student going from class to class in regards to keeping his sugar levels maintained so that he can focus on his schoolwork? And he knows that that's a tough question. Gosh, I don't know to begin where to start other than maintaining the sugar levels so that he can focus on his schoolwork. That's where keeping a blood glucose log is very important so that you can see where those blood sugars might be getting out of whack and where you might need to work with your doctor, or depending on your level of feeling comfortable making changes, where you might need to make some tweaks to his regimen during the day. The other thing is, in as much as you can, if your child can test in the classroom, that will certainly allow him or her to not be singled out, to not have to walk down to the nurse's office and miss that class time, and obviously therefore be very distracted from the importance of being in the classroom, both for social and educational reasons. Okay, Angela or Chris, unless you have something to add to that, I would like to go ahead and move on to travel. Are you all okay with moving on?
Yes.
Okay, great. Okay, so travel. Go ahead and start sending in your questions. Some of the things that you might want to think about are things that you put in your carry-on bag versus your checked bag when you're traveling on an airplane. Metal detectors when you have to go through security. What if there's a time change? How to handle that with insulin pumps and Lantus schedules. Angela, do you have anything from your own experience that you would want to offer here?
No, we've never had it. We've always just, if we were traveling, we would always carry the insulin and the supplies with us. Just, you know, we need to, if your luggage is lost, you have to have that with you. And so we just have always carried it on, and we usually have a doctor's note that we are traveling, and you know, this is what needs to happen, because for a while there was some issues with fluid ounces and stuff, and once they see the doctor's note, we have not ever had any problems. We just go on through.
Yeah, that's a great suggestion. I've always had a doctor's note also, and of course I've never been asked for it, but as soon as I quit bringing one along, I'll get asked for it. But so yeah, I think that's a great thing to have just in case you do need it. I have a comment from a parent that she has her daughter carry her meter, stuff her loads, and a cell phone in her purse. Oh, I'm sorry, that was about school. With her so that when she changes classes in case of an emergency. Also comment, always, as far as the travel, always carry supplies in carry-on bag and ask to have the pump hand checked. The daughter removes her pump and does have it hand checked. And that is, I would assume, what this mom is referring to is the concern about the going through the security and the metal detectors. So yeah, I've heard, I think various people have various thoughts about whether or not that really affects it, but again, better safe than sorry, in my opinion. So someone else is asking, what is in the doctor's note? Angela, can you tell us that?
Our endocrinologist would just write, Reagan will be traveling. She is required to have, or she must have, insulin vials, syringes, and something else. he would just list what she is required to have with her at all times, and there are no exceptions that this has to stay with her. So, you know, also my husband was diabetic also, and he travels quite often, and he had more of a challenge with this than my child, but he just had that note with him all the time, and once they see it's a note, this is what he has to have, then, you know, we never had any problems going through security.
Okay, great. Thank you. We're pushing our time, but I don't want to skip this question, so I'm going to ask it. It's from someone. My son is traveling by plane by himself for the first time later this week to see his grandparents. Any tips? Not knowing the age of your son, I think, again, just being as prepared as possible with 2 backups of everything. You know, a lot of juice boxes, a lot of however it is that you treat lows, backup Lantus, backup, if that's what you're on, backup insulin, whatever it happens to be, and test kits and batteries and pokers and all that. Oh, he's 13. Thank you. So yeah, so Melanie, it sounds like that from a self-management standpoint, I doubt that you'd put him on an airplane if you didn't feel confident about his ability to do that. So my opinion would be, like I just said, just a lot of backup, and the more the better. So, okay, we're going to go ahead and move on to extreme situations that people might find themselves in. Oh, I'm sorry. I'm in the wrong spot. So as far as the extreme, if we could first talk about school, and I know that Chris will have a lot of suggestions here as far as, you know, what if there is a lockdown, or what if a fire drill, or heaven forbid a real fire, what things parents and school nurses need to keep in mind. So Chris?
You bet. We all know that children that have diabetes are going to require additional disaster preparedness planning for medication, for food and water availability, and this could happen, you know, like she mentioned, during a prolonged lockdown, shelter in place. I know here in Kansas we have lots of tornado warnings, and sometimes we can be in a shelter for a couple of hours easily. In my particular school district, we start as early as kindergarten trying to have all of the students self-manage their diabetes in the classroom. And we begin educating the teachers, the paras, that we allow the students to self-manage as much as possible. And that way, if there is some type of a disaster situation like that, we feel comfortable that the student knows that that teacher could assist them, or a classroom para, etc. We also have a list in my school district of what we would expect for that disaster emergency supply kit for each of those type 1 diabetics, and that would be their meter and their testing strips, transit batteries, you know, their insulin, their syringes or pumps, definitely some antiseptic wipes, wet wipes, that quick-acting source of glucose. We also encourage our type 1 diabetics to carry some type of a backpack or whatever they're comfortable with wherever they go throughout the building, because if a shooter came into our building and they were in the library, even though we've done this great disaster planning for what to do in that classroom setting, they're halfway across the campus in the library. So we've had really good luck working with our type 1 diabetic students and staff, and they'll carry their little backpack or fanny pack with them wherever they go throughout the school setting, and they would have whatever supplies they need, hopefully, for that extended period of time. We also realize that in a situation such as a bus accident can happen when the child's being transported to and from school. So you cannot forget to provide information and education to all those support staff too, which includes your bus drivers. So we have glucose tablets and quick-acting glucose on all of our buses. We have signs and symptoms of hypo and hyperglycemia. We work one-on-one with the bus driver, the students, and the parents. And then this also filters through to our coaches with our extracurricular activity, et cetera. And I know Angela will be able to provide even more information, but you can't prepare for everything, but you've got to prepare for those things that are the most apt to happen. And as a school nurse knows, it might not even be a tornado or shooting or a lockdown. It could be an emergency situation, a medical emergency, where you could have a staff member that's having a possible heart attack or some type of a seizure, and it's at the same time that you're supposed to be in, helping that type 1 diabetic student. So I think the better planning, the more proactive we are on our mitigative efforts, and empowering all those people that are right there with the students, then I think the more comfortable the students are going to be, and hopefully we'll be able to help them self-manage their diabetes.
Great, thank you. Again, for the sake of time, I am going to go ahead and move on to travel. And so now we're not talking about your average everyday travel situations, but more, what if we get stranded? What if I'm sure no airlines would ever do this, but what if you get stuck on the runway for 2 hours? So hopefully none of you have been through that, but I bet at least a couple of you have. What if the supplies get stolen or misplaced or malfunction? I can tell you, I'll try to make this brief, but just last weekend I picked Sarah up from diabetes camp, and we immediately got on the road for a 4-hour drive to celebrate my grandmother's 90th birthday. And about an hour into the drive, Sarah looked at me and said, "Did you bring my test kit?" And I said, "No, Sarah, I didn't," trying to stay calm, and because I'm a good, calm mom. And she said, "Well, did you bring my insulin or anything?" "No, Sarah, I didn't." So it was funny that, and I told her about that I have this webinar coming up, and I asked her if she was testing me. But, sure enough, it is something that's going to happen. And you would think with her being 16 and having this 10 years and being very good at self-management that she would not have forgotten that these things, again, just happen. So what I did is contacted my doctor. Well, first I looked forward to where we would be in about 30 minutes as far as drugstores. I then called my doctor's office and was able to immediately provide the doctor on call with the phone number and the fax number to the drugstore, and they were able to call in those supplies for us. So, and again, I think that our children learn from how we react, and yeah, it was not the smartest thing in the world that she forgot her test kit and all her supplies, but it's human, and we've all forgotten things on a trip before. So I think acknowledging that and understanding that and not coming down on our kids is very important, because they are kids, and I think that they are too many times forced into being more responsible than a normal 16-year-old or 5-year-old or 10-year-old. So Angela, do you have any travel tips, nightmares?
No, we've actually had good luck with that, but my one suggestion is we live in a small town, and sometimes when we are on the road, we can go several, 30 minutes to 45 minutes before we see another town or gas station, and so for my daughter to look over and say, "I think I'm going low and I need something," and we don't have anything in the car, we're in trouble. So my suggestion would be just to always have supplies on hand, snacks, just to real quick. We had a school lockdown, but when my daughter was first diagnosed, and she had already used her snack, but then she's like, "I'm going low and I'm in a lockdown." Well, we didn't prepare for double whammy in one day, and so my thing with travel, school, anything, just to have those snacks and our juice boxes on hand.
Great, thank you. Okay, I want to go ahead and move on to natural disasters, and we are going to hear Angela's story about going through a tornado. Let me preface this story, and I apologize, I meant to preface this entire webinar with this, but a lot of what we hope that will come to light through this discussion and this webinar is that none of us is perfect. And I think that we're disservicing ourselves and our children by trying to hold ourselves up to those standards. So, you know, like someone said just a minute ago, we can have every checklist in the world and think that we are 100% prepared, but there's always going to be something that throws a kink in things, or it might be just a really stupid something, and you're going to hit yourself over the head. But you just can't be perfect all the time. So I want to go ahead and turn it over to Angela to tell her story for us.
Okay. I live in Oklahoma, which everyone knows we have our share of tornadoes. Actually, in the town where I live, we've had several. We're always in the path of tornadoes. So, you know, for years where we've lived here, I have always, since Reagan has been diagnosed, I have always thought, what do I need for the next couple hours? I know there's a tornado warning, but it never hits us, so I'm just going to prepare for what we need in the next couple hours. And so if Reagan had her pump on and she had a snack in her hand, you know, that was all the preparation that I would do. You know, we'd go to the storm shelter. Until 2011, we had a tornado that came through our town and completely wiped out a path. I live in a small town, and you know, we were out of electricity for days. So I learned so much from that, and it changed the way that I prepare us. So what I wanted to share today is the things that I ran into, just the scenarios that can happen when you are in a town where you come out of your storm shelter and everything's flattened. The pharmacy that you use, no one has power. You know, you're on your cell phone constantly. Your phone can go dead. So there's just so much that I realized I wasn't really being prepared. And so I kind of just made a little binder. And what I have in the binder, I keep in the storm shelter. Now, I have a list of Reagan's medication and her doses. I have a list of our healthcare professionals and their numbers, thinking I'm not always going to have the cell phone. It's going to go dead. How do I get a hold? I rely so much on my cell phone. So I'd have their numbers written down. I also have the copy of the care plan that we give to the school. I copy that care plan and I put in this binder that we keep. I also keep a copy of our insurance cards. If I don't make it to the storm shelter with my purse, which I did this time, but you know, I don't have any proof of even who we are, and I need insurance cards if I have to go get more medication, because the pharmacy that we use would not be available to me. So that's something else. During our storm season, pretty much in Oklahoma, it's from late March to even this year in June, late June. So I never run low or go like, you know, sometimes you're like, you know your child is on the last vial of insulin or the last dispenser of test strips, and I never go that low during this season because I just know it's storm season. But we have a bag that we keep on our kitchen counter during tornado season. And this is what I have learned that I need in that bag. We have extra test strips. We have a glucagon. We have, my daughter wears an insulin pump. And before the tornado, I just thought, oh, what she has in her pump will do. But that's not true, because her as soon as we came out of our storm shelter, we went directly to recovery mode, picking out of debris and moving around and, you know, so many lifting and stuff, and her sight would rip out. And then all of a sudden we don't have the extra supplies that she needed to get the insulin pump back in. So I learned we have to have extra quick sets or whatever she uses for her pump. And we also do needles. If she has to go to shots, then, you know, we have that insulin, we have the needles, extra batteries for both her tester and for her insulin pump. We also have an extra meter. I keep juices, snacks, and water in our storm shelter, so they're there whenever we're there. I change them out every season. When I clean out the storm shelter, I make Reagan a little box of food and stuff that she's going to need. You know, you can be in there sometimes for, you know, I've heard people be in there for 24 hours. So I've decided I have to think extreme instead of just, you know, a couple of hours. And also her pump supplies, the adhesives, you know, the alcohol that she uses, anything that she would use in her daily life, I would have down there in abundance because of just anything can happen during that time. We were without power, and we even had friends that had lost their entire house, and we were able to help them through, you know, getting their daughter medication and stuff. But what I really thought I was prepared before, but now this is my checklist that I use, and we keep it on our counter. When the sirens go off and we go into the storm shelter, we grab that bag, and we know that everything that we possibly need is in that bag. So that's kind of what I learned through the last couple of years.
Thank you, Angela. I appreciate that. Is there anything that you do as far as what you keep on your child's person? As far, I know that all of our children should wear diabetes alert jewelry of some sort, but is there, besides that, any type of identification, something that would provide your phone number or emergency contact information if, heaven forbid, you got separated from her?
My daughter wears a necklace, but she also has a bracelet, and it says type 1 diabetic. I have not, as far as just having in her cell phone, in case of emergency, the ICE and then my number. No, she doesn't, which is something she probably should do. That's another great tip. But other than just having that bracelet on or her necklace on, we don't, you know, have anything with her name on it.
Yeah. Okay. We've not gotten any questions or comments. We did have a comment back when we talked about travel, about someone said that they keep pixie sticks in the car. That's a great idea as far as treating lows, because it won't go bad, unlike juicy juice boxes. We have another comment. It might be a good idea when an insulin bottle is about 3/4 gone, put it in an emergency bag and replace it each time each insulin bottle gets to 3/4 gone. That's a good suggestion as well. I'll open it up for any other questions or comments. Anything that you wanted to ask before that you've not asked about any other topic? I'm not seeing anything as of now. So just as a reminder, we do have, time check here, we do have just a couple more minutes for the webinar. We will provide checklists, any checklist that we've referred to that Angela referred to, that Chris talked about as a nurse checklist that she provides to parents. All these checklists will be made available on our website, and a copy of the transcript, meaning everyone's suggestions and questions, will be made available, as well as a recording of this webinar. of course, feel free to pass along that information to any friends or anyone who you know who was not able to make it to the webinar. And those will be available here in 2 days on Thursday, August 1st. And there you will see our web address so that you'll know how to get to that information. We do have a Facebook page, so if you forget what this web address is, our Facebook is MyCareConnect. So feel free to go out there, and we'll have an announcement about the webinar recording there as well. So finally, I want to thank everyone for being here. If there is anything that we didn't cover, I encourage you now to go ahead and speak now or forever hold your peace. Feel free to write us an email after this webinar if you have suggestions for future topics. Okay, we do have a couple of comments and questions that have come in here. One is, I work with our local hospital pediatric diabetic group, and can she pass along the binder idea? Absolutely. Anything that has been talked about in this webinar is for everyone's benefit. So any ideas you hear, absolutely, feel free to use them for yourself. Does the insulin truly expire in 1 month, or is it okay to go over 30 days? I think that is certainly something where it depends on who you ask. I've never stuck to that 30-day rule. My school nurse, you know, I'm sure in trying to stick to the rules, was very made certain that I replaced insulin vials after 30 days. So I don't want to give you a professional opinion on that because I'm not a professional, but I personally have done that in a pinch. So let's see. Thanks to both speakers for their time and sharing with us. Well, you're very welcome. So I guess that is it. Again, I thank all of you for your attendance and your questions and your advice. I think it's great for us to all be able to share this information with each other. And I hope that all of you have a great evening. Thank you.
Thank you very much.